Trachoma is an eye disease caused by infection with the bacteria Chlamydia trachomatis, and it's the leading infectious cause of blindness in the world. It continues to be a public health problem in at least 44 countries, with South Sudan having among the highest burden worldwide. Ongoing conflict and extreme weather have left millions displaced and hampered efforts to get the disease under control. Access to clean water and sanitation is limited. World Health Organization and UNICEF figures show that just 41% of South Sudanese have access to basic, safely managed drinking water, and just 11% access basic sanitation. Without good access to clean water and the ability to practice good hygiene, infections like trachoma, which transmits from person to person through eye and nose discharge, thrive.
Most of the community, they live in crowded areas. They have shortage of water. The hygiene is very poor. And also there's also lack of sensitization. Some of them, ideally, they don't even know about the disease. In areas where people don't properly wash their eyes, there's a discharge, and the discharge attracts the flies. So the flies can easily settle in one eye, then after some time it can also flow and settle in the other eye.
To target trachoma infections and bring them under control, it's crucial to know just where they're happening, how big the burden is, and what environmental factors are causing them to persist. Government ministries can then better target interventions like treatment to prevent future spread. But the burden of trachoma was unknown for many counties in South Sudan, and for those that had data, it wasn't up to date. But in March 2021, the UK aid-funded ASCEND programme, standing for Accelerating the Sustainable Control and Elimination of Neglected Tropical Diseases, partnered with AMREF Health Africa to take on the challenge and access these regions to map the disease, despite further limitations caused by the COVID-19 pandemic.
Now, after this survey, we will be able to provide the surgical mobile operations to these areas that we have identified, the trichitis cases, the TT. Then we will be also able to provide the MD, that is the mass drug distribution to the areas that have got intensified cases. I think as a public health officer and a researcher also, this will also allow us to publish data and mobilize for resources to provide the basic sanitation services to these locations.
Surveying involves teams of medical graders and recorders dispatched out to these communities to check the living conditions and eyesight of everyone residing there. But to identify and map cases of trachoma well, the graders need to be trained to have a thorough understanding of the various stages of trachoma, as well as WHO guidelines on its control to determine whether it's a public health problem. The specific objectives of the survey were to estimate and explore 1. The prevalence of trachoma, TF, in children aged 1 to 9 years old. 2. The prevalence of potentially blinding trachoma, TT, in people aged 15 years or above. And third, to explore water and sanitation facilities. This, in turn, will be used to determine how effectively interventions have been implemented, who has had access to surgeries and treatment and who hasn't, and where mass drug administration is still needed and why. The overall aim is to plan and implement the next course of activities, such as the delivery of antibiotic treatments, that will eventually eliminate trachoma as a public health concern. And while this is the process for all trachoma endemic countries, local experts stress that the situation in South Sudan is very different.
During the rain season, it's very difficult for us to reach all the areas. Secondly, there is some insecurity in some areas. It also makes it difficult for us to reach those areas. The third one, it is funding.
In South Sudan, the number of people living in poverty and in rural and disconnected locations is fueled by civil unrest and often flooding, causing many communities to become displaced and living in these hard-to-reach areas. But this didn't stop the ASEN teams from reaching them. Using a combination of air, road and river transport, they made their way to even the most remote communities, because no road links and poor water supplies mean these are the communities most affected by trachoma. They found that 6 of the 11 evaluation units mapped showed active trachoma infections in 1 to 9-year-olds were above the 5% threshold set by the WHO. This means it continues to be a public health concern and will require continued control efforts, as well as regular impact surveys to keep an eye on infection levels. But this also means that infections in 5 out of the 11 evaluation units were below this threshold. These units will therefore only need to continue water and sanitation interventions until surveillance surveys take place in 2 years. Trichiasis among people aged 15 years and over, where either 1 or more eyelashes are rubbing on the eye, or it appears eyelashes have been plucked because they were rubbing, had more bleak results. Here, 9 out of 11 evaluation units were above WHO thresholds and in need of surgical interventions.
Trachoma can blind somebody, but when you realize it at an early stage, like if you find the person still have follicles, have the intents, you give tetracycline ointment, the person is treated, he will not develop the scars, he will not have trichiasis, the person will be prevented from blindness, which is so good to me.
Based on the result from the survey, the first step that should be taken is that we should plan for mass drug administration and also surgical intervention, plus facial cleanings and environment improvement activities. As ASEN is now closing, it's very difficult for us to predict who will come after ASEN, but I hope Ministry of Health will lobby with partners to call for other funding to bridge the gap that ASEN is now leaving behind.
Blindness from trachoma is irreversible, not like cataract. Cataract, you can regain your vision when the cataract is extracted, but for trachoma, no. When it reaches that state of CO, which is corneal opacity, that's the end of your vision. We just do surgery to relieve the pain, but to regain the sight, no. So this is a dangerous part of trachoma.
Bia coin ba dog really jol in area. A bin cani tan a boy, a bin cani ro bako, a bacham. A cayenne a kimuna then tow each. Luella coin.